Today, we're diving into the incredibly important, often really demanding world of healthcare professionals.
Yeah, specifically those folks caring for our nation's veterans. It's essential work.
It really is. But it makes you ask, what happens when the very people providing that critical care get injured on the job?
That's the core question, isn't it?
So this deep dive, it's all about the vital VA hospitals right here in the Kansas City region. We're covering facilities in Kansas City, Missouri, and over in eastern Kansas, Topeka and Leavenworth.
We'll look at their histories, which are pretty fascinating, the huge care network they've built.
And crucially, the unique challenges their federal employees face with workplace injuries.
Right. Our mission here is really to help you understand the support systems that are out there for these essential workers.
Especially when it comes to navigating that, well, sometimes complex federal workers' compensation process.
And to do that, we've looked into historical records for these VA places, detailed info on federal workers' comp, and also resources from a specialized federal injury center in Kansas City itself.
Okay, let's begin by understanding the scope here. When we talk VA care in the Midwest, these aren't just any institutions, are they? They're foundational.
Absolutely. Foundational is the right word. Take the Kansas City VA Medical Center in Missouri. That opened back in 1952.
Wow, 52.
Yeah, and it was quite something for its time. Hailed as the newest and most modern facility for caring for veterans in the United States back then. Started with about 300 beds.
Just 300.
Initially, yeah. It's obviously grown and been modernized a lot since then. It's now a key part of the VA's Heartland network, VISN 15.
Got it. And what about in Kansas?
Well, you've got the Colmery O'Neill VA Medical Center in Topeka. It's named after Harry W. Colmery. He was a World War I vet, and interestingly, a key architect of the GI Bill.
Oh, really? The GI Bill?
Yeah. Its roots go back to 1946. It actually took over the old Winter General Army Hospital after World War II.
So repurposed military facilities.
Exactly. And its campus, the main building, they're actually listed on the National Register of Historic Places. Very significant. It later integrated with Leavenworth in '98.
Okay, and Leavenworth, you mentioned that one too.
Right. The Dwight D. Eisenhower VA Medical Center in Leavenworth. This one's truly one of the oldest VA campuses in the whole country.
Older than Topeka.
Oh, yeah, much older. It started way back in 1885. It was the western branch of the National Home for Disabled Volunteer Soldiers. The first one west of the Mississippi, actually.
1885? That's incredible.
It is. The current VA hospital building there was finished in 1933, named after Eisenhower, of course. By the end of World War II, it was massive, over 1,000 beds, plus a large domiciliary.
A domiciliary? What's that exactly?
It's basically like a long-term residential facility for veterans who needed that kind of support. All on this huge park-like campus. And like Topeka, it merged administratively in 1998 to form the VA Eastern Kansas healthcare system.
So these places have deep roots, but what's really striking is they aren't just historical sites, right? They're active, bustling hubs today.
Spot on. They're incredibly busy and reach far out into the community.
Yeah.
The Kansas City VA alone, it cares for over 50,000 veterans every single year. Has about 142 inpatient beds now.
50,000, that's a huge number.
It is. And it's not just the main hospital. It oversees 9 community-based outpatient clinics, CBOCs, spread all across western Missouri and into eastern Kansas, too. Places like Warrensburg, Belton, Overland Park, Shawnee.
So bringing care closer to where veterans live.
Precisely.
Yeah.
And the VA Eastern Kansas system, so Topeka and Leavenworth combined, they treat around 41,500 veterans each year.
Another big number.
Yeah, covering a massive 20,000 square mile area, 39 counties across Kansas and Missouri. And they're supported by 8 more community clinics in places like Lawrence, Junction City, St. Joseph.
Wow, it's a really extensive network.
It is. And another important point, both of these systems, Kansas City and Eastern Kansas, they're teaching hospitals.
Meaning they train new doctors and nurses.
Exactly. Training the next generation of health professionals, which is, absolutely vital for the future of veteran care.
So if we connect this all together, these aren't just hospitals. They're huge, coordinated networks relying on thousands of dedicated people.
Absolutely. A massive effort, day in and day out.
Okay, so that brings us back to those dedicated people. What does all this mean for them? The folks working inside these facilities day after day. Helping others, it turns out, can be, well, physically tough.
It really can be. And VA staff, being federal workers, they face certain kinds of occupational hazards that are pretty common in healthcare settings.
Like what specifically?
Well, One of the biggest categories, maybe the most frequent, is musculoskeletal injuries.
Okay.
Think about the work: heavy lifting, transferring patients, lots of repetitive movements, especially in nursing, and direct patient care.
Right.
So we see a lot of back strains, neck injuries, shoulder tears are common,
Mm.
joint problems, herniated discs. These are consistently some of the top reported injuries in hospitals everywhere, not just the VA.
Makes sense. What else?
Slips, trips, and falls are unfortunately pretty common too.
Yeah, I can imagine. Busy hallways.
Exactly. Busy corridors, maybe slippery floors from spills or cleaning, sometimes just cluttered areas. These can lead to sprains, fractures, sometimes even head injuries. Ankles, knees, wrists often get hurt.
Okay, so physical injuries from movement and falls.
No.
Anything else?
Yes, exposure-related illnesses. Healthcare workers are, regularly around infectious diseases, bloodborne pathogens, things like that.
Right, that's a known risk.
And also hazardous chemicals, medications, potent cleaning agents. While it's not always like an immediate physical blow, getting sick from these exposures on the job, like contracting an infection or having a bad chemical reaction, that's considered an occupational illness. Covered.
Got it. What about the mental side? It must be stressful work.
Immensely.
Yeah.
And that's the other major category. Stress-related conditions. VA employees often work in really high-stress environments.
Especially dealing with serious injuries or trauma.
Exactly. Working closely with veterans who might have very serious physical injuries or complex mental health needs, that constant emotional strain, it takes a toll.
So what kind of conditions does that lead to?
It can lead to significant occupational stress injuries. Things like clinical anxiety, depression, even PTSD in some cases, burnout, compassion fatigue. These are very real, and they are recognized workplace issues.
It's really important for you as a listener to grasp the depth of this. These aren't just, small bumps and bruises or a bad day. They can be serious, long-term conditions.
Definitely. And they require specific, effective support systems.
Which raises that key question. If a VA employee does get injured, how do they actually get help? It's not like calling your regular state workers' comp board, is it?
Not at all. It's a completely different system.
So federal employees, like everyone working at these VA hospitals, they don't use state workers' comp. It's a federal program, right?
That's absolutely correct.
Yeah.
Federal employees, including all the VA staff, they go through the U.S. Department of Labor's Office of Workers' Compensation Programs, OWCP.
OWCP.
And it operates under the Federal Employees Compensation Act, or FECA. It's a whole separate world from state systems.
So if you're a VA employee and you get hurt, what's the first thing you absolutely have to do?
Immediate reporting. That's step one. You must notify your supervisor as soon as the injury or illness happens. Prompt documentation is just essential.
Why so critical?
Well, in the federal system, delays can really complicate things. Timeliness in reporting and filing is often a key factor in getting a claim approved smoothly. Getting it documented right away is paramount.
Okay, report immediately. Then what? Forms, I assume?
Lots of forms. You need to complete the correct OWCP form. If it was a sudden injury, like a fall or a specific incident, you file Form CA1. That's the Federal Employees Notice of Traumatic Injury.
CA1 for traumatic injury, got it.
But if it's an injury or illness that developed over time, maybe from repetitive stress like carpal tunnel, that it's Form CA2. That's the Notice of Occupational Disease and Claim for Compensation.
CA2 for occupational disease.
And there are time frames. Ideally, you want that CA1 filed within 30 days to secure certain benefits, like continuation of pay. And here's a really important point. Just getting a claim number back from OWCP, that only means they received your form. It doesn't mean your claim is accepted.
Ah, okay, that's a key distinction. What about getting medical help?
Crucial. You, as a federal employee, have the right to choose your treating physician.
You get to pick your own doctor.
Yes. In an emergency, obviously, go to the nearest ER. But for follow-up or non-emergencies, it's really wise to consider doctors who have experience with OWCP claims. They understand the documentation needed.
That makes sense. Is there any help with paying for that initial care?
Sometimes. Yes. Your VA employer might issue you a Form CA16. That's an authorization for examination and and/or treatment. If they give you that, it basically guarantees payment for your initial medical care for up to 60 days while the claim is processed.
Okay, CA16 for initial payment authorization. Then comes the evidence part, right?
Absolutely paramount. Documentation and evidence. You need things like witness statements, if there were any, accident reports, and critically detailed medical reports from your doctor.
What makes a medical report detailed for OWCP?
It needs to clearly explicitly link your injury or illness to your specific work duties or a specific incident at work. Just saying back pain isn't enough. The doctor needs to explain how the work caused the back pain. OWCP needs that causal link spelled out.
So the doctor's report is vital.
Hugely vital. And keep copies of absolutely everything you submit or receive. Everything. We often see that initial denials aren't even about whether the injury happened, but whether the medical report successfully tells the story OWCP needs to hear, that connection to work.
And if it does get denied initially?
There are appeal rights. Many claims are initially denied, often because of incomplete forms or that insufficient medical evidence, but you can appeal.
Okay. And what about keeping track of it all?
You have to be proactive. Follow up on your claim status. Respond promptly if OWCP asks for more information. Deadlines are important. And it's often really helpful to loop in your union, if you remember.
How can the union help?
They can be a huge help. They often assist with the paperwork, advise you on your rights like continuation of pay, which is basically getting your regular salary for up to 45 days if you filed a CA1 and can't work because of the injury. They can provide general guidance and support through the process.
So it sounds like, wow, a lot of specific steps, a lot of paperwork. That could feel really overwhelming, especially if you're injured and just trying to recover.
It definitely can be daunting, which is why, it's fascinating that there are specialized resources designed specifically to help federal employees through exactly this process.
Right, like the center you mentioned earlier, Restore Muscle and Joint, operating as a federal injury center in Kansas City. How do places like that actually help an injured VA employee?
They provide really multifaceted support, tackling several key areas. First off, they offer expert OWCP claim guidance.
So help with the forms and process.
Exactly. As they put it, navigating the OWCP claim process can be complex. Our team provides step-by-step assistance, ensuring VA employees understand their rights and how to secure their benefits effectively. They help make sure forms are filled out right, explain entitlements, and really help people avoid those common mistakes that lead to denials.
Okay, guidance is huge. What else?
Well, they also provide the actual medical care and physical therapy. They're doctors and therapists. They're specifically experienced with OWCP. They know how to treat the kinds of injuries common among VA staff: back problems, joint issues, sprains, strains.
And they tailor the recovery plan.
Yes, focused on personalized recovery plans, aiming to get employees back to work safely. And crucially, they know how to document that treatment for OWCP.
Ah, back to the documentation.
Always back to the documentation. That's maybe the biggest strategic benefit they offer, ensuring proper medical evidence. Their doctors understand the specific medical narrative OWCP requires. They connect the injury clearly to the work event, outline any disability.
And they know why claims get denied.
Precisely. They know, as they say, that denials may occur due to incomplete forms or insufficient medical evidence, so they work hard to prevent that. And if a claim is initially denied, they can help with the appeal process too.
So they handle the medical side and the paperwork guidance. Anything else?
Yeah, they also manage the coordination of care. If you need referrals, they handle that. They communicate with the OWCP examiners, which can be huge. And they help with all the necessary forms during treatment too, like the CA-17 duty status reports your doctor fills out, or the CA-7 form for claiming wage loss compensation if you're out of work.
So they kind of act like a case manager through the whole thing.
In many ways, yes.
Yeah.
A dedicated guide. And finally, they bring a lot of experience working with different federal agencies, including the VA, and also with the unions. They understand the specific landscape.
So they can talk the talk with the VA and the union reps.
Exactly. They can communicate effectively, act as a, quote, trusted partner. That specialized knowledge lets the injured employee focus more on just getting better without getting totally buried in red tape.
That sounds incredibly valuable. And you mentioned unions earlier. They're another huge layer of support here, right?
Absolutely critical. The American Federation of Government Employees, AFGE, that's the largest federal employee union, they represent a lot of VA staff.
Are they active in the Kansas City area VAs?
Oh, yes. AFGE Local 910 is right there at the Kansas City VA Medical Center.
Yeah.
And AFGE Local 906 represents employees in the VA Eastern Kansas system, so Topeka, and some folks in Leavenworth, too.
And what do the locals do for injured members?
They're invaluable. They assist members with navigating OWCP claims. They make sure management actually honors the doctor's work restrictions when someone returns, and they'll step in if there are disputes.
Okay, so AFGE is big. Are there others?
Yep, another important one is the National Federation of Federal Employees, NFFE. They represent some VA employees too, sometimes more professional staff like registered nurses.
Any NFFE locals in our area?
Yes, NFFE Local 1765 is at the Dwight D. Eisenhower VAMC in Leavenworth. And just like AFGE, NFFE advocates strongly for safe working conditions and helps its members through workers' comp issues.
So, the unions play a really active role.
Definitely. Their activism over the years has pushed for things like better safe patient handling policies and training. They provide that organized voice and a crucial safety net for workers who get injured.
So if we connect this back, this whole network, the specialized centers like Restore, the active unions, it means injured VA employees don't have to just figure this all out on their own.
Exactly. There's a structure of support there designed specifically for the federal system they're in.
Okay, here's where it gets really interesting. Let's make this concrete. Can we walk through some fictional scenarios, maybe based on real situations, to see how these support systems actually work in practice?
Absolutely. Let's take, say, Maria. She's a nursing assistant at the Kansas City VA Medical Center. She's moving a patient, and she suffers a lumbar strain, a back injury.
Okay, common scenario. What happens next for Maria?
So Maria does the right thing, reports it immediately, fills out her Form CA1. Her supervisor gives her a Form CA16 authorizing treatment. She chooses to go to Restore Muscle and Joint.
And a Restore does.
They diagnose the lumbar strain, start her on physical therapy. And critically, they write a detailed medical report explaining exactly how moving that patient caused this specific injury. Very clear causal link.
And that helps the claim.
Big time. Because of that clear documentation, her OWCP claim gets accepted pretty smoothly. Plus, her AFGE union rep gets involved, helps make sure the VA finds appropriate light-duty work for her while she recovers.
So good outcome for Maria.
Yes. She recovers with the PT, returns to her full duties, and even gets some new training on safer lifting techniques.
Okay, great example. How about another one, maybe a different kind of injury?
Let's take John. He's a maintenance worker over at the Dwight D. Eisenhower VA in Leavenworth. He slips on a wet floor, falls, and fractures his wrist. Also injures his knee.
Okay, a slip and fall. Traumatic injury again.
Right. So he files a CA1, gets initial treatment maybe at the VA's own ER because it's an urgency, but then follows up at Restore Muscle and Joint for ongoing care.
And Restore provides the OWCP-specific documentation.
Exactly. They write up a comprehensive report, sometimes called a CA20 attending physician's report, meticulously linking both the wrist fracture and the knee injury directly to that fall on the wet floor.
Does his claim go through easily?
Let's say OWCP has a few questions initially. Maybe they need more detail. But Restore provides the clarification. Maybe a coworker provides a witness statement about the wet floor. With that support, the claim gets approved.
And the union's role here?
His union, maybe NFFE Local 1765 in Leavenworth, gets involved.
Yeah.
The union president checks on his entitlements, makes sure he knows about applying for wage loss compensation while he's off work for surgery and recovery.
So John gets surgery?
Yeah, maybe wrist surgery, then extensive physical therapy for both injuries. He eventually returns to light duty, then back to his regular maintenance tasks.
Okay, that shows how persistence and support help. What about an illness that develops over time?
Good question. Let's imagine Aiko, a health technician, maybe a nurse's aide, at Colmery O'Neill in Topeka. She develops carpal tunnel syndrome.
From repetitive work.
Exactly. Constant computer use, handling instruments, that kind of thing. This isn't a single event. It's an occupational illness that developed over months or years.
So she files a different form.
Right. She files a Form CA2, Notice of Occupational Disease. Maybe her supervisor is supportive. Her union steward helps guide her with the form.
Is proving an occupational disease harder?
It can be. Requires strong medical evidence linking the condition to the job duties over time. Let's say Restore Muscle and Joint provides therapy, and their medical reports, maybe along with an ergonomic assessment of her workstation, convince OWCP. Claim accepted.
Does she need time off?
Let's say she does need some time off for intensive therapy. Restore helps her file the CA7 form to get wage loss benefits during that period.
And the outcome for Aiko?
She improves with therapy, manages to avoid surgery. Importantly, her workstation gets adjusted with ergonomic improvements to prevent the problem from coming back. And maybe she even becomes a safety advocate in her unit.
That's a great outcome. One more. What about the stress claims you mentioned? They sound tough.
They could be very challenging to get approved by OWCP. Let's consider David, a psychologist at the Kansas City VA. He's dealing with some very difficult traumatic cases and develops severe stress, maybe secondary traumatic stress. It gets bad enough he needs to take a leave of absence.
So a mental health injury directly from the work?
Yes. He files a claim, likely a CA2 as it developed over time, but stress claims are complex. Maybe restore muscle and joint, connecting with a clinical psychologist or psychiatrist who specifically understands federal workers' mental health claims.
Why is that specialization important?
Because OWCP has very specific criteria for stress claims. You often need detailed reports linking the condition not just to general stress, but to specific work incidents or conditions that meet their threshold. Let's say David's psychiatrist provides that detailed report, making the connection clear.
And OWCP accepts it.
In this scenario, yes, his claim for an acute stress disorder related to his work is accepted. He receives appropriate therapy and wage benefits while he's recovering.
What about returning to work?
His union, maybe AFGE Local 910, plays a role here, ensuring the VA provides necessary accommodations when he's ready to return, perhaps adjusting his caseload initially. David recovers, returns to work, and maybe his experience even leads the VA to implement more peer support programs for mental health staff.
Wow. These stories, even fictionalized, they really paint a picture of the whole journey, don't they? From the injury itself through the process to recovery. And it really highlights how vital those layers of support, the medical expertise, the claims guidance, the union advocacy truly are.
Absolutely. They show how these systems are supposed to work when all the pieces fall into place.
So, okay, we've unpacked a lot today. We've talked about the incredible, crucial work happening at these VA hospitals in the Kansas City region, the dedication of their staff.
Right, and the deep history behind those facilities.
But we've also really dug into the unique and sometimes serious challenges these caregivers face when they themselves get injured doing that vital work.
And I think it's so important to just reinforce those key takeaways for anyone listening, especially federal employees. First, the absolute necessity of swift action. If you're injured, report it immediately.
Get that paperwork started right away.
Exactly. Second, really try to understand the nuances of the OWCP process, know which form to file, the importance of medical evidence linking injury to work.
And third,
Critically, utilize the resources available to you. Don't try to go it alone. Places like specialized federal injury centers, Restore Muscle and Joint is the example here in KC. They exist specifically to help navigate this. And lean on your union for advocacy and support.
and Restore Muscle and Joint. You mentioned they offer something for federal workers.
Yeah, they offer a free claim consultation. It's a chance to get advice up front. As they emphasize, your health and livelihood are too important to risk. If you get injured on the job, reach out for a free claim review and let us help you get back on your feet.
That's great practical advice. So as you, our listener, reflect on this deep dive, think not just about the amazing history and the scale of veteran care we discussed,
But also think about the people, the unsung heroes, providing that care every single day.
and maybe ask, what more can be done to really ensure their well-being is always prioritized, especially when their jobs inherently put them at risk? It's something to think about.
Definitely. Just remember, knowledge really is power here. Understanding these systems, knowing your rights, knowing where to turn for help, that's the first, most crucial step in making sure that the people who care for our veterans are properly cared for themselves when they need it most.